Thank you so much. We also have another colleague, Regina Kaku, who is a chair here at Barani Dispensary. Those are the people we are working with here at Barani Dispensary. We are so glad. As I end, I'd like to welcome my boss, Mr. Tongi.
Thank you very much, Khan. Head of Primary Health Care, Dr. Lungu, Dr. Marianne, CHPF Board Trustees, German doctors, our esteemed partners, my dear colleagues, our CHPs, ladies and gentlemen, good morning. It is an honor for me to stand before you here today in commemoration and celebration of this very wonderful day of our lady facility, Barani Dispensary. Mr. Mungu, before you joined us in Kilifi County, I used to work in Malindi, and I was posted to Kilifi South in 2021, around August, and in the month of, in July, and in that very month, I was invited to attend the ceremony of opening of Barani Dispensary. So this is the only and the first facility I gladly participated in opening of this facility. Barani, in its dynamic location and the vastness of the population here, and with the current upgrading of Mpwapwa Sub-County Hospital to level 4, most of our communities are coming to this facility. We have been working with a lot of challenges, but I'm very happy until today, until this day, this facility is still open, it's still offering services to the community, and it's serving the community here at the best they can. They have not received yet a cent. I know the support staff here, they wish to see me after this celebration, but I'm very happy the services are still being offered to the community. So when I talk about Barani, I talk from the center of my heart. And I'm very happy that we are having this celebration at Barani. This our gathering here is going to be very short. That's why I started with first expressing what is in my heart about Barani. And I'll go directly to my speech. Ladies and gentlemen, honored guests, partners and community members, good morning. It is with great pleasure and pride that I stand before you today as we launch the continuation and expansion of the enhanced primary health care in Kilifi South. This project marks a significant milestone in our shared journey towards improving health outcomes for our community. The success of this initial pilot project, improving maternal and community health through enhanced universal health coverage, implemented in partnership with German doctors, the Community Health Promotion Fund, North Coast Medical Training College, and Bomani Multi-Dispensary in Kilifi County, was a testament to the power of collaboration and commitment to health equity. That project laid a strong foundation, and today we are proud to apart from the services offered via PCN multidisciplinary teams in the 5 spokes. Rolling clinics will now reach even more families, providing them with essential care they need right at their doorstep. This means expanded access to critical services, including maternal and child health, treatment of common illness, and other primary care services. Without the barriers of distance or cost for vulnerable families in Kilifi South. This represents more than just healthcare. It is an opportunity for better health, better lives, and brighter future for our people. Our deep gratitude goes to our partners, the German doctors, whose continued support has made this expansion possible. Your dedication to healthcare in marginalized communities and your belief in this project are truly commendable. Together with our local partners, we have proven that through collaboration, we must continue to support these efforts, ensure the sustainability of services provided, and work toward integrating these gains into our long-term health strategy. In conclusion, let this expansion be a celebration of progress, of partnership, and of the resilience of the Kilifi community. With the expansion of curative services to Barani, Junju, and Chepeni, we can take another step closer to achieving universal health coverage for all. Thank you, and let us all continue to work together to build a healthier future for our community. Thank you very much. And at this point, I wish to call upon our head of primary healthcare, Mr. Edward Mumbo, that very one person who had mobilized for us to establish our PCN in Kilifi South, and he had been pushing us. We start our MDT activities as much as we can. So, Mr. Mumbo, thank you, sir, for coming, and karibu, sir. Please.
So much, but some small Swahili, some kabla sijazungumza, ningetaka kutambua such an example. Difficult. So probably because of the interest of the colleagues that cannot appreciate well the Kiswahili language, I would want to appreciate the organizers of this event this morning and today. And before I say what I'm to say, I want to acknowledge the presence of German doctors and partners from North Coast Training College, our physician in South County, the team of the healthcare providers, and all the other distinguished guests that have found time to come and inaugurate our rolling clinic in this area of Barani. So before I say what I'm to say, I want to welcome Dr. Aya, say a good morning, and then probably I will also welcome Dr. Zakaria to say one or two, and then probably I say what I want to say as much. All protocols observed. I appreciate everybody that has come. Let's tell you.
Head of Division Primary Healthcare in Kilifi County, our MOH, SAD, Kilifi South County, the German doctors, and my fellow healthcare workers and the general public. Good morning. So it is my pleasure to be here today. I didn't know Barani, but now I'm here. So last year around August, there was this establishment of the primary healthcare network in the South. It was a very good start, but later on we found ourselves not really doing some activities. But here comes the time whereby, on behalf of, together with collaborating with the German doctors, CHPF, we are really doing something great. And I really want to thank the German doctors for coming up with this innovative way of providing healthcare services to the community through the rolling clinic. So one of the primary role of this primary care network is to try to, bring efficiency in our operations when it comes to patients referral as well as accessing health services to the community. So I take this opportunity to thank everyone and as a team, and I'm sure the able lead Mumbo, Sultan and all the partners, I'm sure will ensure that primary care services are being provided at the lowest level of healthcare in our community. Thank you very much.
I will go to the Germans and
Yes. So yeah, very good morning to everybody, to the county and sub-county level staff and people. I'm also want to say hello to the Hilbarani staff. I'm very happy to meet you. MOH of course, and yeah, every guest from the, also learned newly from the Primary Health Network. I'm very happy to meet you all. Yeah, thanks for the invitation, for inviting me today to take part of this opening. I'm very happy to be here. Also, I bring many regards from my boss, from Dr. Christine. She's a coordinator in Germany. So yeah, very many greetings. She will also come to visit the project very soon, so she can also see what's going on around. Yeah, and I'm also very happy to learn about the changes of the project that's going on now with the rolling clinics coming out in the different areas. So I think that was also a long planning process in advance, so I'm really happy to see that's now opening officially, it's really working, it's going on. And me as an MLP position, I'm always very interested of course in learning what's really changing because of having the rolling clinic here. So I'm really happy to learn in the next weeks, months and maybe years to learn what's really changing for the community we serve, for the people in need, for the vulnerable people. So yeah, I'm happy to be part of the process and support here and there. And thank you so much for inviting me.
So everybody is talking good that we have a better tomorrow.
still want them to do the same. Especially Mr. Mumbo, Dr. Sultan, Annika, Mustafa, Romani was here, the German doctors who are visiting today, that we are really achieving what we want to achieve. Collaboration in supporting primary health care. The first one was when we opened the Bomani collaboration, where we have been working together since 2021. With the county, with the clinic, with North Coast, with German doctors also that time, and then now today. I think for us what we want, and for me as a person what I want is exactly what all those people have said. Can we improve primary health care? As CHPF we said in 2015, let's try to see how we can work with the county and specifically the sub-county of Kilifi South in improving primary health care. We want our students to be very good in healthcare generally, and I believe we're on the way, but we want you particularly to be good at community health and primary care level. We want that the people of Kilifi will receive good healthcare when they go to Kilifi County, when they go to Mutwapa, but we don't want them to bypass, and we want them to feel that when they come to Barani, they get services that address most of their needs, and only you cannot do that. And I think that's what we've all worked towards, and I think when we started collaborating, we didn't know each other very well. We were the private sector, so to say. The county was the county. We had all this getting acquainted to one another across, but I believe over the years we have started to trust one another. We've started to get more and more, and we know we all try from where we stand. I remember when we first tried to go into an MOU with the county, which questions do I get? What is your budget? Do we have bills? We don't have budget. We don't have bills of course. What we say is that if we collaborate, we will try to do our best to make things better. If I ask Dr. Sultan, what is your budget? He says he's not even able to give any coin to Barani. When I ask Mumbo, what budget do you have for the NDT? He says, okay, maybe we will wait for the SHA to do its effects in the primary care fund. You know, there are things beyond our control. We try to pull the lines we have, we try to do the things we can, we try to access. But where I'm very happy with this house is that we really work together as a team. Everybody's playing a good role. And I like very much, Mumbo, when you also mentioned, we also have not only food today, we do together what we get, but we also look at tomorrow and next year and years thereafter, how to make it sustainable. I think that is what we all want, and I can
to look to amplify my voice because maybe your voices are better than mine. So thank you very much again. Thank you, Daktari, for coming. To the MOH director, the physician and the team lead for the MDT, and the representative of the German doctors that spoke, and all of us team members that have come. I want to take this opportunity on behalf of the Department of Health and Sanitation Services in this county to first of all wish us all a good morning. I had a meeting very early in the morning with the minister, and we discussed about my coming here today. And what we were saying is we are walking the talk, because it is the governor's manifesto that we strive as much as possible to take the services to the community level. In the mashinani, I want to appreciate the effort and the contribution of the German doctors, because they are doing it in a very special way. That over the recent past, because they are not very old in the protocol of running the Roni clinics, but in the recent past,
a lot of good work has happened in this county, especially in Kilifi South. And in the idea of taking services closer to the community, members have to cover to just go and see that consultant for the condition that they have that they need a support about. But the initiative of launching this rolling clinic is coming handy in making sure that services are going to go near to the doorstep of that client. In that doing, therefore, reducing the cost of healthcare. The services might be very free or at zero subsidy at the health facility, but the amounts of monies that the clientele pay to reach that consultant, to reach that service is hefty. And in that way, therefore, services become inaccessible. But the rolling clinics that we are launching today here at Barani is for the purpose of making sure that health services are readily accessible and available to the community of Barani and the Kilifi South at large. We are here because we want to have a better tomorrow. And coming here as a rolling clinic team, together with the multidisciplinary team from the government. In collaboration, we are aiming at providing a consolidated and comprehensive package of care that the community really requires. Today, the non-communicable diseases are leading in terms of mortality, and they are leading in terms of morbidity. Some of the clients that we see in the health facilities might not know that they have a chronic condition like hypertension, diabetes, and cancer. Today, cancer, diabetes, and hypertension are the persons that are leading. We give an opportunity of and mortality community members and in the Kilifi at large. Therefore, the rolling clinics that we are launching today,
they will know. And when you know that you have a condition, then you take advantage of seeking healthcare services. And by so doing, then complications that would probably befall you are taken away from you, and you live a better life tomorrow. That continue becoming a very productive member of society. So the rolling clinics that we have today is a government agenda. It's not a government doctor's agenda. It's a government agenda. And us as government, through His Excellency, the Governor, we are calling it a multidisciplinary team. Because the rolling clinic is not run by one country. It's run by a number of practitioners. We have a gynecologist, that very has come there. We have a physician here. We have an MD specialist here. We have a general practitioner there. We have an ENT specialist and many others. But as we come together as we have come, therefore we are able to provide
that we do in terms of the number of the visits, but again the number of the visits in relation to the number of the people indeed that we serve, because that can be me, the son of my mother, coming here thrice in a month. So the workload becomes very heavy, but the person that you are seeing is only one. So we want, as we come to serve the community, at the end of the day, if we had not come as a rolling clinic MDT, what danger could we have imposed to the data that we have? And out of our coming here 4 times a month, what is the contribution to the workload that Barani dispensary has seen? And that is the only way that we can showcase to all the partners that are supporting us that our going there is having an objective and it's yielding results. So I'm looking forward to walking the journey with the German doctors and the MDT for Kilifi South. That will make a difference at the end of the day in the health of the community of Kilifi South. The endeavor is not going to end here. We are going to run at least 7 sites, Barani being one of them. We are every day at Bomani. We want to extend the services to Mutepeni. we want to support Junju, we want to support Pingilikani, Vipingo, Chasimba, and Kizingo in the near future. And if we did that, that is the way to go, because all the services that the community members would have otherwise traveled all that way to come to the Mtwapa sub-county teaching referral hospital, because not only a sub-county hospital, we do a lot of teaching to the students there, some of them from the North Coast Medical Training Center. So it is our Mtwapa sub-county teaching and referral hospital. People who would have traveled miles to reach there, but now instead of them coming, we want to take the services to the community. Instead of referring patients, we want us to refer the services to the clients. And by so doing, then we become very efficient, like Dr. Yah has said. We use very little resource to capture a very big number of community that is in need of our service. So this, the government of Kilifi highly appreciates and support. The minister is in it, the chief is in it, the director is in it, and the governor is in it. We would want to have a model center that the governor would come one day to say thank you to the German doctors and also appreciate the community for utilizing the services. But that we need to showcase that as we do this, this is the yield, and it's supporting the community in moving towards a better community of Kilifi. Our vision is a healthier community that is productive. And we are only going to be healthier if we utilize the services that God has given us to offer. Because what we are giving the community is a service that God has given us. So if we are able to provide that service to the community, and the community uses that service, eventually everybody benefits. So I want to thank the teamwork between the MDT and the German doctors, because together everyone achieves more. And as everybody achieves more, the community becomes healthier, and we live a better life. So today, to me, is a memorable occasion. We have had quite a number of rolling clinics, but today on my side, it's a very memorable moment, because we are launching the rolling clinics in Barani, and we'll be coming here every week. So this to me is an advantage, because as a department alone, probably would have taken us many other months to come. But I would want to acknowledge and appreciate the spirit of the German doctors and the North Coast Medical Training College that has found it really worthy today to partner and collaborate with us as the Department of Health to come and serve the community of Barani. I'm looking forward to a positive and productive collaboration and partnership that will deliver to a better health community in Barani and the Kilifi South at large. So thank you so very much. I would have talked, but because the community members are waiting, and I also want to talk to them one or two issues, I want to thank you so very much for this launch. Let the rolling clinic live longer and serve the purpose intended in the Kilifi South and in Barani dispensary. Thank you so very much. Thank you very much. I didn't see that coming. I didn't see that coming. Thank you very much. Thank you so very much. Okay, karibuni sana kwa huduma. I want to talk to the community briefly. So I'll carry my gadgets. Yeah, because we're in a new dispensation. We are moving from NHIF to SHA. So I want to talk to the community briefly, and also thereafter, I will have a separate talk with the support staff for the facility and the health promoters for the facility. I have one or two to talk to them. But first of all, let me say hi to the community members and the beneficiaries of the service. Thank you so very much, Dr. Marianne. I'm humbled. Thank you, daktari. Thank you very much. Hii kitu Thank you so very much. There's somebody who gave me her pen.
Rejesho zingine zenye zimetoka kule ndani waingie ndani waendelee. So unaangaliana hiyo pressure Isabella, sumlink na Halima. Halima hasa Halima mmoja huyo.
Regina, kama ni yule tukamwona.
Si alikuwa hapa. Hata introduce Nilikuwa nataka Halima juu Halima si anachukua hizo records pia ingie pale. Nilikuwa nataka Halima
Ama ni nini?
na zile bana. Sio? Umeenda streaming?
Ama
Interview tutafanya vipi?
kama utafanya hapa ndio tuone huko.
Chukue na hii.
Ama tunaweza kuchukua na wewe, lakini hii microphone ningetaka itumike. Ningetaka hii microphone itumie hii microphone.
Hii ni ndefu hii. Sawa. Badilisha lens.
Kwa nini nabadilisha?
Hadi.
Ndomshi hiyo itafika, angalia distance ya hiyo. Moja nilikuwa nishafunga.
Ama basi. Hapa hivi. Wewe sio? Hapa. Hiyo kamera songe mbele.
Vuta. Hii angalia kianguka chini.
Hapa. Ona wanipata
niendelee. Sisi tunashukuru kwa na watu wa pressure, sukari, mambo mengi wamekuwa wakitusupport. Sasa hii tunashukuru sana kwa sababu German doctors wamekuwa wakitusaidia, lakini hizo enzi za nyuma zilikuwa yani tuna maana watu walikuwa wanajaa, daktari ni mmoja, kila kitu ni yeye, lakini ikifika Friday sasa hii sisi tunashukuru, tumeona manufaa ya German doctors tukiendelea vizuri hata katika community. Nasifu sana hii German support Barani dispensary. Ni hayo na tunaomba waendelee. Thank you.
Utanunua pale, nataka nikaulizie kesi yako kwa daktari yule. Sababu hapa wako wote au specialist. Keti tu hapa na
Weka hapo kwa rolling clinics hapo. Kwa maji. Mtu anachukua maji yangu. Chukua ya. Ni kitu na zaendi, sio? Kitu na zaendi. Wamulika wako na lezi hapo. Wamulika wako na lezi tu kidogo.